Now joined by Dr. Rahul Gupta, who is Director of the Office for National Drug Control Policy, is responsible for coordinating drug policy in the United States. So, Dr. Gupta, thank you very much for your time and thank you for being with us this evening. 70,000 deaths a year, the biggest killer of people aged 18 to 49, children dying, kids dying daily, as Mark just told us. Why is the US government failing to protect its citizens and its children from fentanyl?
Well, let's first talk about why this is happening. It's happening because we lack a continuous treatment infrastructure for addiction. It's happening because the traffickers are continuing to profit in a dispassionate way, out of vulnerable Americans. And this is exactly from day one, President Biden has been focused on. And what we are trying to do is build an addiction treatment infrastructure while going after the trafficking and the profits. And we're making some of the most historic progress as you talk about harm reduction, expanding treatment, and then making sure that we're going after the bad guys to hold them accountable.
I mean, but all of that is going to do nothing for the parents of that 15-year-old in Kyle, Texas, who's just died from an overdose because of this stuff.
That's exactly right. And, I have children. I'm a parent. I'm also a physician, somebody who has himself attended funerals of people and sobbed. Part of the reason is that we don't want this to happen. We want to make sure that my own high school, now I'm seeing overdoses in the Washington area. It is important that we meet where young people are, make sure that they are aware of the dangers of getting pills that are not from a pharmacy or from a doctor, and make sure that they're carrying naloxone or Narcan. And that's exactly what we're doing when we put out a social media campaign from the White House with Ad Council to make young people aware of these dangers. The fact is today that ordering a pill online, whether it's Adderall or Xanax or anything, the counterfeit nature of it is more dangerous than playing Russian roulette with your life. And we want to make sure that every young person across America is aware of that.
Yeah, it's important that message gets out. Some $46 billion has been assigned to try and fight this issue. How much of that is going towards stopping it coming across the border, and how much of that is going into that treatment prevention infrastructure you talked about?
Yeah, that's a good question. We have about 57% of this is going towards treatment, and rest is going towards addressing the supply side. And what we're trying to do is two things. First, making sure we have a plan. What we do now, we're seeing about 8 months of flattening or decrease in these historic numbers. Yet we're not there. We have a long way to go. Secondly, we're trying to make sure that the world community knows that the synthetic issue is a global threat. There's three types of countries in this world right now, today, unfortunately. One, those who have a synthetic drugs like fentanyl problem and know about it, like United States. Others who have a problem don't yet know about it. And the third category is those who are going to have this problem in the future of synthetic drugs. This has really become a global menace. And it's really important for the United States, as we are doing, to lead on this effort, because the trafficking is becoming more internationalized as well.
Yeah, and I'm glad that you touched on that, Dr. Gupta. Where does the UK fall in those categories, do you think? Have we got a synthetic drug problem now and we don't know about it, or is it coming?
Well, first of all, we know that, I've met with my colleagues and counterparts in the UK. There's obviously opioids problem like heroin and others, but will not be a surprise that it also falls victim to a synthetic problem. And that is why, my counterparts in the UK are very active in supporting, working with the United States, as are many other countries across the globe, to move forward to make sure that we are taking proactive steps, not only reactive, but proactive steps to both have surveillance, monitoring, but also then denying the profits that these trafficking organizations survive on, both operating capital and profits. We deny them those in order to beat this particular crisis.
OK, Dr. Rahul Gupta, do appreciate your time and expertise. Thank you very much for being with us.
Thank you.